Doc, first off, do you think we already have a community transmission of the Delta variant that's based, of course, on available data?
Yeah, definitely. When we had that increase in the cases, that was a week ago, and the trend was really a drastic and significant increase. That in itself is already a characteristic of the Delta variant. And I think a lot of us know that although the samples that were sequenced by the Philippine Genome Center from August 11 to 12 were only like 373 for each of those days, but more than 100, no? So like 48% of those sequence are the Delta variant. So just that small representations of sample sequence, when you have more than 48% of the samples are Delta variant, then we would presume that this is now the current and most likely the variant that drives the transmission in the community.
Dr. Rontgene would like to know the situation on the ground at least in San Lazaro Hospital in Manila. How is the hospital holding up? And what would you like, or what do you think rather will be the implications of the Delta variant?
Yeah. So for the past 2 days, our bed capacity is almost full. We are more than 85% in our total bed capacity. And our ICU, Risa, is almost 124%. So meaning we exceeded the capacity of our ICU. And that's something that we would like to be monitoring, because when you are having 70% of patients that are admitted, severe and critical, then that's something that there is really something going on in the community. And I think the scenario here, no, if the projection is that number of cases in the next few days, the scenario here will be having lots of these more severe critical that cannot be accommodated anymore in the ICU. Some of these patients will just be intense in the emergency room, and then you will also expect higher mortality for these severe critical patients.
Doc, do you have data as to how many of your COVID-19 patients are vaccinated and the number that are not? And what are your other observations?
My first observation is we also have more younger population, no, compared to the previous surge. Second is that although in the severe critical, the majority are still in the 60 years old and above, but we also have less than 60 years old in this mix of severe and critical. And 70% of those who are in the severe critical have received has not received any vaccine. So that means a lot, no? That when you are vaccinated, you have more protection compared to the non-vaccinated. And for those vaccinated who develop severe and critical, these are also in the age group between 70 up to 80 years old. So these are the elderly. We know that vaccines still work, but not as much in terms of protecting them against the severe critical.
Dr. Solante would like to get your reaction to the shift of Metro Manila and other hotspots to MECQ. Are the lockdowns still helpful on surges at this point?
I was observing during the time when we have the ECQ, when we have still lots of these cases, and then when we will now be on the MECQ, I don't think there will be any difference. The more important part now is to really strengthen the implementation of the protocol, especially at the level of the LGU. We in the hospital level, we are only dependent on how the cases will be coming from the community and coming from the LGU. And in fact, the most important, really, the strategy should be focused on the community transmission.
Dr. Rontgene, how about what else could the government do, both on the national level and the LGUs, to again prevent, of course, more infections from happening?
What's still very crucial, and I think this has already been mentioned by several other experts, is to really strengthen the way we do active case finding, because when we have a very highly transmissible infection, case finding is the key to stop and slow down the transmission. When you do the case finding, you test, and then when you diagnose, you also do aggressive isolation and quarantine measures, particularly for those who are in the household, because the the household transmission is really enormous at this point in time. Most of our patients have relatives or members in the household are also sick, and I think that's where the what we call this, the center of the transmission of most of these cases.
Mhm. Dr. Solante, have you received updates on the other variants, such as the Lambda variant? And are there also new studies on vaccine efficacy against these variants?
Well, for the Lambda variant, it's still considered as a variant of interest, and there is a potential that they can also decrease the efficacy or effectiveness of some vaccines, but we need more data, and we'll have to wait for the data that, like what variants of concern has been doing now, that it has reduced some of the efficacy of vaccines. That's why in some countries it has been the cause of the surge of cases, and they're now on the level of giving booster shots.
Mhm. As always, thank you so much for sharing with us your time and your insights. That's Dr. Rontgene Solante. He is head of adult infectious disease at the San Lazaro Hospital in Manila.
Thank you.